Hi, I'm Nirav Savalia. I'm a board-certified plastic surgeon in Newport Beach. If you've been considering a breast augmentation, you probably have a lot of questions. Let's walk through your thoughts and your questions one by one. Number one, implant size. How do you decide what size implant is appropriate for you? The decision-making process for that is far too complicated for you to come to me and say, I want a 375cc implant because my friend had one. That's not how that works. We take into account your anatomy, your breast width, your skin tone, your elasticity, the amount of tissue you have, your chest wall curvature. There's all sorts of things that go into deciding exactly what size implant will give you the result you're looking for. But the key here is the result you're looking for. And how do you communicate that? Well, there are various ways that you can help me learn exactly what you're looking for. And one of those is by showing me photos. You can go through multiple photo galleries online. They exist of women that have had breast augmentation procedures and say, here are 2 or 3 that really stand out to me that really seem like this is exactly what I want. And if you show me those pictures, I will be able to look through those pictures and find the key things that are common between them and identify what it is that you're really trying to achieve, both in terms of shape as well as size and volume, and help you decide which profile, which type of implant, silicone, saline, etc., is going to be the best option for you. If you're debating, do I get a saline implant? Do I get a silicone implant? Well, the choice is pretty clear. If you're looking for the best looking and feeling implant in terms of natural, that's going to be a silicone implant. If you have a thick pad of breast tissue that can cover the implant so we can mask it. So if you have almost no breast tissue, you're a small A cup and you want to go to a C cup, a saline implant is likely to give you a result that's going to be plagued with some palpable or visible rippling of the implant through the skin. So you're going to see it through the skin, either on the top or on the sides. But if you have a lot of tissue, so when I say a lot, to me, a lot means about 1 to 2 centimeters of tissue, which is not a lot in terms of overall breast volume, but that's a lot to cover an implant. If you have that much tissue, then you can have a saline implant of a modest size and get a very good result too. In terms of durability, how long do these implants last? Whether it's saline or silicone, the studies have essentially shown, I'm going to give an average here, that 90% of implants will last at least 10 years or longer, meaning the 10% of implants are going to leak in the first 10 years. The remaining 90% that make it to 10 years will probably go on much longer than even that. To do a breast enhancement, obviously, we need to place an incision somewhere. Where should that scar go? In an ideal world, I usually recommend a small, about an inch scar or less than an inch scar underneath the breast in the crease. For me, that gives you the most direct access to the area you want to be, which is underneath the breast tissue. But there are alternatives. You can have a scar placed right at the border of the areola. It's a hidden location because the scar heals really nicely there, but to get to the actual bottom of the breast and get under the breast, you do have to go through some breast tissue. So it's a little bit more of a difficult dissection, and it does end up creating some trauma to the breast itself, whereas you can avoid a lot of that by going with a scar just hidden underneath in the crease of the breast. A third option is what's called the transaxillary approach, where the incision is hidden in the armpit. That scar usually heals pretty nicely. That's why people like it, is because it's a hidden scar in a sense. But if you're putting an implant in through that approach and you're going, let's say, underneath the muscle, which is the most common place to put an implant, the points of dissection that you need to really focus on, which are the pec muscle attachments at the sternum and at the bottom of the breast, you're furthest away from those points when you're working from the armpit. And I've done many revisions of patients who've had transaxillary breast augmentations where the implants just never really dropped into place or stayed too high because those muscles were kind of incompletely released, or maybe not released at all because they're just so far away from where you're trying to work. So in my practice, I don't do that approach. I do offer the inframammary or under the breast scar, or the periareolar, which is under the areola scar. I think both are options, but I strongly encourage the inframammary approach. After a breast augmentation, you're likely wondering, what is the recovery process like? In my practice, I have crafted a enhanced recovery after surgery protocol, which is hand-tailored to you to help you recover the fastest and the easiest from a breast augmentation. Several things go into that. First is what you do before surgery. You're going to obviously maintain optimal nutrition and protein intake, and you're going to be focusing on trying to prevent infection after surgery. So you're going to be bathing with an antibacterial soap for about a week leading up to surgery. Then on the day of surgery, we're going to do things that help minimize your pain and recovery. We're going to pre-medicate you with certain things that are going to lower your nausea after surgery, that are going to lower your pain after surgery. And then in surgery, we're also going to make sure to use meticulous technique. One of the things that I really kind of hone in on is understanding that if we're putting in an implant under the muscle, which is the type of augmentation that has more discomfort than if you were to go on top of the muscle. But if you're going under the muscle with a dual plane type of technique, you do have to release the muscle attachments. And that means you're working right on top of the rib cage where the muscle sits. My very strong focus during surgery is to minimize contact with that rib cage with any type of instrumentation, with either breast retractors or either forceps that we're using. I try not to touch that rib cage at all because that's usually what causes a pain cascade. So I will do things that allow me to work without touching that rib cage, putting in the implant with minimal trauma, minimal bleeding, getting in to the breast as quickly as possible so we're efficient, because the time under anesthesia also I think relates to pain. And then using some medications that I instill into the breast once the implant's in to help relieve pain and discomfort immediately post-operatively. And then start you on a protocol after surgery that involves a large dose of Tylenol and Advil. I will allow both. I know that was anathema a long time ago, where Advil was a no-no for surgery. I think the combination of Tylenol plus Advil after surgery has largely replaced the use of narcotics in my practice. So most of my patients will be very comfortable with just those two medications. Occasionally, you will take a muscle relaxer if your implants are under the muscle. If they're on top of the muscle, you will not need a muscle relaxer at all. And you will find that you sleep pretty well that first night. It's a little uncomfortable. You'll be sitting propped up for the first couple of nights, but you will sleep. By the second day, you don't have to sleep propped up anymore. You can sleep totally flat on your back. You can turn a little bit to your side. You're allowed to shower after that second day. You kind of feel more like yourself. And you find that you start to taper off medications by the third and fifth day. And by the end of a week, you can probably drive yourself back to a post-op visit if you were so inclined. And hopefully by the end of 2 weeks, you're off of all medications and back to work if you want it to be. In fact, honestly, I think you can be back to work much sooner than that. It just depends on how easy or hard you want to make it on yourself as far as recovery. But if you want to go back to work, I think patients are easily able to get back to work by 3 to 5 days. I have a lot of students that go back to school within a week after surgery. But the key thing is, as part of your recovery, you don't want to do anything physically strenuous. So you want to relax for about a month in terms of physical exercise or strenuous activities. Just give that a month. You can get back to a desk job, you can go back to school, you can go back to daily activities, but just refrain from physically strenuous activities for a month. If you're concerned about breastfeeding after our breast augmentation, that's a valid concern, of course, because we're messing with the breast, we're putting an implant there. But the less you mess with the breast, meaning you don't dissect through any breast tissue, the more likely it is you are to preserve breastfeeding potential. Not everybody who has children is going to be able to breastfeed with or without implants. But if you get implants, you're likely to blame the implants for your lack of ability to breastfeed. So I try to do all the things I can to make sure that we don't traumatize the breast at all, so that if you have a breast augmentation and you were destined to breastfeed, you should be able to. And that means by placing the scar underneath the breast in the crease, we can put the implant in without touching the breast tissue at all or minimal contact with it, so we have no damage to the breast tissue. By placing the incision far away from the areola, we can make sure that we're minimizing any damage to any kind of ducts that lead up to the nipple. And by doing those two things alone, I think we can safely preserve your ability to breastfeed, or you to be able to breastfeed at all. So if you're interested in a breast augmentation, we would be happy to see you at our office here in Newport Beach. I have a boutique practice. We're a small practice. You're going to have an unrushed consultation. We're going to take care to know who you are, what you're looking to achieve, and help curate and design a customized plan that's suited for you.